Joining us now is the director of the CDC, Dr. Rochelle Walensky. Dr. Walensky, good morning. It's always good to have you. I want to start with that concerning announcement from the FDA that those rapid antigen tests may not be as sensitive at detecting the Omicron variant. The Biden administration is about to send out 500 million of these tests. Can they still be trusted?
Good morning, Whit. Thanks for having me. Yes, absolutely. So we do know that the most sensitive test that you can do is a PCR test. So if you have symptoms and you have a negative antigen test, then we do ask you to go and get a PCR to make sure that those symptoms are not attributable to COVID. But those antigen tests still work quite well, and they work well, especially in places that we're using like in higher education, in tests to stay in schools where we're doing several tests, one every other day, every third day, and that's really when they work well as well. So we still are encouraging their use. They may not work as well as they had for the Delta variant.
So speaking of testing, those new CDC guidelines announced this week reducing the isolation period from 10 to 5 days. Many are applauding the move, but you're also facing some criticism for not including a test out policy. Former Surgeon General Jerome Adams said that this is not about the best science. It's more of a compromise to keep the economy open. Why didn't you include a testing component?
So first, let me sort of back up and say, we had a lot of science to inform our decisions, and it was science in many different areas. The first was, how does the virus work? How is viral decay happening? And we do know that the vast majority of viral transmission happens in those first 5 days, somewhere in the 85 to 90% range. So we're really talking, if you can isolate for those first 5 days, that would be great. We also know epidemiologically that we anticipate a lot of cases. We've seen in other countries that up to 4 or 5% of people may have infection. And so we really do need to prepare for what happens, especially if those people are asymptomatic or mildly symptomatic, and they really are ready to go out and about. And then, of course, third is behavior. We've seen in some studies that up to only a third of people actually isolate when we ask them to. So with all of that science together, we moved forward with isolation recommendations of 5 days of isolation followed by 5 days in a mask. Now, the question of why we didn't include a test there is simply because we know that PCRs can stay positive for up to 12 weeks. So we would have people in isolation for a very long time if we were relying on PCRs.
We have seen those, that's if you can get a test. We've seen those long lines, people standing out in the cold once again. But did the decision have anything to do with the government's ability to actually meet the demand for testing?
So in our isolation recommendations, we did not recommend a test because we did not know what we would do with the information, and it would not inform any further decision making. But in our quarantine recommendations, our recommendations for what you do if you are exposed to the virus, in all of those recommendations, we clearly say that a best practice would be to get a test at 5 days after exposure. So no, it did not.
And what about kids? It wasn't specifically spelled out in the guidance. If they get the virus or are exposed to COVID, what do they do, and how should schools respond to this?
So our recommendations are true for both adults and for children. We do have really clear science now on a test to stay strategy, that if children are exposed, they can safely return to school as long as they're getting a test every day, every other day, every third day. And we've demonstrated over the last month new science that demonstrates that's a very safe way to keep our children in school, and that's really our goal. Of course, the most important thing we can do to keep our children safe is to get them vaccinated.
So if it is the same for parents and kids, does that mean a child who's exposed to another kid in class does not have to quarantine if they're fully vaccinated?
And if they are in a school that has a test to stay strategy.
Dr. Walensky, thank you so much for your time this morning. We appreciate it.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.